Our Kristen Severance found out it could actually take months at this point before some of these frontline workers even get vaccinated. Kristen, please tell me what happened here.
Dan, the plan set up by county health departments to get all of the 1A people the vaccine didn't work. So these are 1A people who do not work for a hospital. Think people who work for a private practice, physical therapists, mental health professionals. Now with Governor Brown making teachers eligible for the vaccine, those 1A workers are now competing against educators for the same very limited supply of doses.
Do you feel like the 1A healthcare workers who do not work for a hospital system were totally forgotten about?
Yes, 100%. And I used to work at OHSU. Like I worked at OHSU until last March. And so all of my friends and everybody I know are all getting their vaccines. And I'm like, well, how can I get to it? How can I get it? And they're like, it's invite only. And I'm like, how do you get the invite?
Ange is a medical assistant at a private internal medicine family practice clinic. She's in Oregon's 1A vaccination group.
And like, we're not even taking care of our first responders. You know, there's the heroes that we've all, everyone's been like, oh, we support you guys as first responders. But then all of us out here in the community are being left to beg basically for our vaccinations.
Gwen Welch has been trying to get the 15 employees at her mental health clinic vaccinated so they can safely see people in the office.
We work with children, we work with, teachers, we work with elderly, we work with all populations who really do need to be seen.
Kate Wood wants to get vaccinated so she can continue volunteering at COVID testing sites.
How are people getting these invitations to get vaccinated? It's a mystery.
County health officials told all of these 1A workers and thousands more to fill out this survey on January 12th. Then public health would match them with a vaccinator. More than 60,000 people wanted appointments. 11,000 were sent invitations. The remaining 50,000 did not get an invite. Now, the public health officials who set up the survey are shutting it down. Those 50,000 1A workers who did not get an appointment will have to start all over again and sign up for a vaccine appointment through a new state-run online system. County public health officials blame the change on the governor for adding teachers to the mix too early and blame the Oregon Health Authority for not sending the metro area enough vaccines. The survey was up for more than 2 weeks with people continuing to sign up. I asked in a news conference why the counties left it up for so long only to shut it down today.
But to be totally honest, we were not able to come to a solution that would actually deal with the number of people that we were talking about. We know folks have heard statewide that the state is close to finishing the 1A group. That may be true for other parts of the state, but it is not true for the metro area.
While 50,000 1A people are still waiting for the vaccine, there are 12,000 doses available for teachers this week in the metro area and just 3,000 earmarked for 1A workers.
Do you have confidence in this system?
No, I don't think we all are laughing about it. It's just been silly. Like, to us, it's like, this is the most disorganized, and this is not a political thing to me at all. I know a lot of people are really angry about Kate and all that. To me, it's not a political thing. It's about a human thing, and we're not taking care of the people who we should be taking care of.
Okay, Kristen Severance, real quick before you leave us, do we have a guesstimate on when these people will be able to eventually get the vaccine?
Yeah, the 1A workers, I would say months. Also, there's one more thing before I go. So this website that these 1A workers and educators are supposed to use to sign up in the 3 metro counties, public health officials said it can't take more than 1,000 appointments at a time and will probably crash.
The website will crash. We're talking about the one where tens of thousands of people are going to be rushing to get kind of a first come, first serve vaccine priority?
That's the one.
Okay. Kristen, thank you.